we go on to Kaduna, Nigeria. Governor Nasir El-Rufai, who has insisted that I call him by his first name. Nasir, I'm going to pose the same questions that I posed to President Akufo-Addo. What did you see? What did you decide to do about it? Why did you decide what you did, and how is it going?
Well, thank you, Kim. On the 20th of February, the very first case of coronavirus was announced in Nigeria. And for us in Kaduna State, Lagos was very far away, yet we knew Lagos is close. This Italian who was the first index case was in Ogun State, but we knew that it's a matter of time that this virus would get to Kaduna State. And fortuitously, exactly a month later, on the 28th of March, I was tested positive for the virus. But before then, it was very clear to us that the response of the Lagos State government was quite appropriate. Lagos was bound to be the epicenter of this virus because it is the major international transportation hub into Nigeria. We knew that Abuja would be next for the same reason. And we also predicted that Kano would be the third because Kano also has international flights coming in and this virus would somehow be imported. For us in the Kaduna State government, what was very clear was that this virus will come to us soon. We had to start preparing, and we assembled our team of public health experts, economists, and so on and so forth. Luckily for me, the Deputy Governor of Kaduna State is a public health consultant. This is her area, epidemiology. So it was easy to let her take charge of the situation. Our Commissioner of Health has been in the UN system for nearly 30 years, also a public health specialist. So we had two ladies that were knowledgeable in this subject and had been involved in the work against Ebola and Lassa fever. And they sufficiently scared all of us in the government of Kaduna State to take extraordinary measures. Now, what is clear to us, even then, is that there is a lot of information, policy, and data absence about this virus. Everyone is guessing. Nobody really knows for sure what to do. We decided that the best thing to do, as far as the Kaduna State government is concerned, is to take extreme measures. So we're the first state to lock down. We locked down on the 25th of March. And we knew that if we could prevent people from Abuja and Lagos from coming into Kaduna, we had a very good chance of slowing down the entry and the spread of the virus. Because we knew from day one that our public health system was incapable of dealing with the deluge of cases. So it was in our own interest to take steps to ensure that the cases, when they come, will be few and far between. So our initial strategy from day one was to keep it out, delay it, and if it comes, in small numbers that we could manage. That's one. Secondly, when we locked down, we also had a package in which we spent 500 million of government funds to buy food and necessities to deliver to the poorest in the society. Because we have an economy in which 60% of our GDP is from the informal sector. Most of the people that are employed in Kaduna State operate in the informal sector, and locking down means they would not have any steady income. So we had to intervene as a government, go into a contingency fund, and literally buy rice, Indomie, and so on, and deliver to households. We are not able to cover the entire state. We took 9 urban and peri-urban local governments and did that. And we knew that that would be the first problem. how do you get the poorest and the most vulnerable to have food during this period? So we implemented that. We also knew that many of our businesses are small and medium enterprises and micro enterprises, and we had to find a way to lock down in a way that they could still operate. So for instance, we exempted all grocery stores, all those that sell food, all pharmacies and patent medicine stores, we exempted them from the lockdown. That enabled some components of the informal sector to continue to operate. We also realized that unless we did something about our schools, about education, many of our children will be left behind. Now, Kaduna State is a poor state. It doesn't have 3G penetration all over. So the question of doing online classes was not something that would work across the state. So we came up with an idea to have lessons for our SS3 students who will be taking WAEC and NECO sometime this year using the radio. So education now for SS3 is using the radio, and we're working on developing similar programs for our primary and secondary schools. So how has this been so far? We've just extended the lockdown by another 30 days. Our initial lockdown was for 30 days. We extended it by another 30 days. I was the first case on the 20th of March. I became the first person to be infected with coronavirus. I got it from Abuja. I infected 4 other people. And since then, the numbers have increased slightly, not as fast as other states because of the extraordinary steps we took to contain the entry and the spread of the virus. Some of our neighbors, unfortunately, have not taken such steps. So we are now at great risk from what is happening in Kano and Katsina. And indeed, last week we took 148 Almajiris from Kano, and when we took them, we put them in an isolation center, tested them, and some were positive. 5 out of 8 that had symptoms were positive. By this morning, another 16 out of 40 picked at random were positive. So the Almajiris from Kano have brought in 21 new infections into Kaduna. So we are putting them in an isolation center and dealing with it. It's been difficult. We've been able to get a large proportion of the informal sector still operating. The enforcement has been quite difficult. Compliance has been uneven, but we feel that it is better we get 50% success than to allow 0% social distancing and so on and so forth. So we've been fairly successful, I would say, in getting the informal part of the economy going. We've used the opportunity to encourage the startup of new businesses, delivery businesses, for instance, that will deliver food to people's homes so that they don't have to go to the market. We've taken a decision now to close down all our markets and open temporary markets so that in neighborhoods, so that people will not have to travel long distances. So it is a very difficult decision because you have to balance life, livelihood, and liberty. Because to lock people down, to prevent most of the people from going out for a month is infringing on their liberty to some extent. But we prioritize life. We decided that we had to do whatever we had to do to ensure that the lives of the people of Kaduna State are protected. And that's why we closed our state. We don't allow vehicles in. We allow, we don't allow passenger vehicles. We allow freight vehicles. We allow the movement of goods and services because Kaduna is a transportation hub and an important commercial center in northern Nigeria. So we allow that. A lot of agriculture is still going on. A lot of transport and logistics businesses are going on. Petroleum products are going through the state, but we want to keep people out, and we've tried to keep people out. We do not think this is the time to relax the lockdown, because in a state of our 10 million people, we've only tested about 200 people. And we have about 20 so far infected. And we do not think we have a handle yet on the footprint of this virus to relax the lockdown. But we believe that every state should look at its own circumstances and take its own decisions. The federal government has taken its own decisions regarding Lagos, Ogun, and the FCT. We are not relaxing. We intend to keep this. It will cost us, and this is why the state government, public servants, and political appointees have all contributed money from their salaries so that we can buy more food and necessities and distribute to the poorest and the most vulnerable. Our first round of distribution relied on communities identifying those that are the poorest. But this second round, we'll be able to get data from telecoms companies, and I want to thank and appreciate the Minister of Communication and Digital Economy that made this possible, and the Executive Vice Chairman of the NCC. We have data now in Kaduna State of all people that have phones that spend less than 100 naira or less than 200 naira or 300 naira a month on their recharge, which means they are poor. So those are the ones that we can now target. We know exactly who to give this food intervention support to, and those are the ones we are targeting. So we hope that our second round of distribution of the food and other necessities will be better targeted and will be fairer. So that's what we are doing. It is difficult to make these policy choices, and nobody is sure about what is right or what is wrong. But what we knew from day one for sure, maybe because my two top advisors are both doctors, is that we'll prioritize the protection of lives. We must do whatever we can to ensure that people of Kaduna State are protected from this virus, and whatever it takes, we'll do it and apologize after. So that's what we've been doing. And but I believe that at the end of the day, each subnational, each country must find its own way and its own solutions. The coronavirus will change the way we live and work for the rest of our lives. The new normal will be quite different from what we used to know. But we also think that it has created opportunities for new businesses to thrive. For instance, now we must all have internet, 3G, 4G, all over the country, because everybody now needs it. A lot of what we'll be doing in education and healthcare will have to be using the internet. Delivery and logistics business will thrive. This is also an opportunity for fintech businesses to rise. This is the time for mobile money to finally take off in Nigeria, because we don't have a choice anymore. And for many of us, governments and the Nigerian elite, this is a wake-up call for us to have a strong and functioning public health system. And we are investing aggressively in strengthening our health system, because for the first time in the history of Nigeria, the Nigerian elite have been locked down in Nigeria. They have to use Nigerian medical care. They cannot go abroad. And this, I think, is another opportunity for us to rebuild our public health systems. And I'm happy and we are grateful to the private sector for coming in and supporting the federal government and the states in this regard. We are grateful to the private sector also for all the contributions they have made, both monetary as well as in kind, food, medical equipment, and commodities that has helped the federal government and the states to fight this virus.
Thank you very much, Nasir. Before